My name is Christine Theriault, and I'm the Prevention Manager here at the Office of Substance Abuse and Mental Health Services in Augusta. I have coordinated with others within other state offices to bring a fetal alcohol spectrum disorder drug-affected baby state coordinator to our state, who is Andrea Pasco at the present time, who has been doing lots of different trainings across the state. She has the ability to go around the state and do training specific to FASD.
My name is Andrea Pasco, and I work for the Maine Office of Substance Abuse and Mental Health Services, which is a part of the Department of Health and Human Services. My title is Fetal Alcohol Spectrum Disorder and Drug-Affected Babies State Coordinator. In this role, I don't provide any direct services per se, other than training. But the history behind this program is in 2005, there was some renewed energy around re-exploring fetal alcohol spectrum disorders. So with regard to FASDs, a big challenge in this particular state is diagnostics and getting an actual diagnosis from which to move forward for effective interventions. And so in addition to diagnostics, a person with an FASD from diagnostic point all the way through the interventions, a person usually has a team. Fortunately, so far from our assessment and survey results, we're finding that folks really don't know in these fields. They don't feel really comfortable making a diagnosis. We do have a handful of folks in Maine that do diagnostics, but they're kind of scattered about. And again, there's no one place for a person to go. So our goal is to create a resource guide for people living with FASD and their caregivers, so that if I'm a mom and my child needs to see a child psychologist, that I can go to this resource guide and I can choose among child psychologists who have demonstrated their knowledge and their ability to work with this population. Great example would be a mom called me from southern Maine, and her son had alcohol-related neurodeficit disorder. And he had been seeing the same psychologist for about 6 years. And when she brought him in at age 12, he had just started going through puberty and was demonstrating all of these behavior issues that were somewhat new. And at the end of the appointment, this psychologist said to the mom, he's just being willful. He doesn't want to follow the rules, and this is behavior management issues. And this mom called me in a state of near fury, because her son had been seeing this provider for 5 years, and yet to that point, he did not seem to understand or be able to articulate that this child's behavior was because of organic brain damage and not choices that the child was making. So she's very involved in this process because as a parent, she's really recognizing that it's very challenging to get services that are really appropriate. And one of my favorite lines is, if an intervention isn't effective, it's not an intervention, and you need to look differently. You need to look outside the box, and a lot of the professionals just aren't trained to do that. So in Maine, we are working really hard to raise awareness. If you think, when was the last time you heard a public service message or saw a TV advertisement or a poster designed to encourage women not to drink alcohol during pregnancy? Chances are it's been a long time, if ever. Largely, the only public warnings that are out there about alcohol in pregnancy are actually on the label of the bottle, which by the time it gets read may be too late. So we are really trying to reinvigorate this message of there's no safe time, there's no safe kind, and there's no safe amount during pregnancy. So One area that is sort of connected with this stigma is the whole issue of trauma. And oftentimes it's childhood trauma, but it could be trauma that occurs in any part of life. And obviously trauma can happen to males as well as females. But in this case, we're really looking at how does trauma impact a female, and how can we encourage her to get treatment and provide treatment for alcohol use, particularly during pregnancy, without re-traumatizing that person. So an example might be if a young woman is all throughout her teen years is sexually abused at home by her brother's older friend, then that young woman is probably going to be hypervigilant in some areas. So say, for example, it would happen in her bedroom in the middle of the night when everyone else is sleeping. Well, now she's in treatment, and she's supposed to have her lights off and her door closed. And as a result, she lays there wide awake all night, every night. She knows in her brain that there really isn't a risk of being re-traumatized, but the situation sort of reawakens or just continuously sort of jabs at her and doesn't allow her to really be in a healing environment. So in that situation, it would be most appropriate to allow her to have a nightlight, potentially allow her to leave her door cracked open, make sure she feels confident that she has the call button, and so that she can call anytime she needs. And if she does use the call button, ensure that you respond really, really quickly to her needs. Because we do know that past trauma can just sort of be re-experienced over and over again. And oftentimes treatment, if not done in a way that's really trauma-informed and trauma-centered, can actually re-victimize these folks and get in the way of any long-term recovery. So I do like this concept of it takes a community to address FASD, and that's on several levels. It certainly takes a community to spread the message that it's not safe to drink alcohol during pregnancy, and to really support pregnant women to take away any of those potential temptations. So the prevention piece is certainly a village or a community is going to make a much bigger impact than one lone voice out there saying, this isn't a good idea. But also as far as raising children with FASD, ideally when someone goes through the diagnostic process and they develop a care plan for managing this disorder, you have a lot of different people involved. You have your pediatrician and your geneticist. You have psychologists, psychiatry, occupational therapy, physical therapy, speech therapy. You've got your school personnel that are involved, whether it's special education or mainstream education. And you may even have respite workers or other folks that are involved in that child's life, extended family, and making sure that everyone involved in that child's life really understands the disorder, that they're not lazy, that they actually they do try really hard, that it's not that they won't do something. If it's not being done, it's probably that they can't do it, and you need to think of another way and help them find another way where they can accomplish that task. If we are able to really raise women's awareness of the risks of consuming any alcohol during pregnancy, and then when those women are presenting as having some difficulties stopping their use, providing them with treatment and services, we could have a day where we don't have FASD in our state or in our country. So it's really encouraging to me that this position is actually funded, that there's 78 people on my task force that are really committed to this issue and spreading knowledge, and even to students who are perhaps doing their research on this topic and sharing this information with others, because it's going to take all of us and all of our voices to make this systemic change.